Transcatheter aortic valve replacement, or TAVR, is a treatment option for people with symptomatic severe aortic stenosis that does not require open heart surgery. Severe aortic stenosis occurs when the aortic heart valve does not open and close properly. This makes your heart work harder to pump blood to the rest of your body. A diseased valve affects your health and limits your daily activities. Before the procedure begins, you will be given anesthesia or a mild sedative to make you comfortable. The entire procedure typically lasts between 1 and 2 hours. The arteries in your body are like a system of roads that branch out from the heart. There are different routes that your doctor can use to implant the Medtronic TAVR heart valve, and all come with their own individual risks. These routes include an artery in your leg, an artery in your neck, and a space between your ribs. Speak with your doctor about which route is best for you. In a typical Medtronic TAVR procedure, the doctor makes a small cut at one of these access points and guides a thin, flexible tube with the TAVR valve into your artery and to your diseased valve. When the TAVR valve reaches your diseased valve, the features of the Medtronic heart valve allow your doctor to reposition it to assist in accurate placement. Once in place, the self-expanding frame of the Medtronic heart valve enables your doctor to deploy it in a controlled and accurate manner. After expanding, the new Medtronic TAVR valve takes over the old valve's function to help blood flow efficiently out of the heart. To complete the procedure, the thin, flexible tube will be removed and the cut will be closed.